All right, I think we can get started, and I'm sure more people will join as we move forward. Again, thanks everyone for joining. Good morning, good afternoon, good evening, depending on where you are in the world. I know we have people joining from all over. My name is Vlad Kavalewski, and I'm a program manager at the Global Disaster Preparedness Center. And we are really excited to have you here. And, I would like to welcome you at our first webinar of what will be a series of webinar over the course of June and July that really focuses on early warning, early action, for so-called last mile communities and how to make them more effective and more inclusive to make sure that such communities and such kind of population groups are considered in early warning systems. Just a little bit of housekeeping before we dive in. The webinar is recorded, yeah, if you don't want to be caught on camera, don't turn off your camera, and and then we will share the recording after the presentation. After the session, the chat is open. As I said, feel free to introduce yourself. Feel free to share, exchange any ideas that may pop up in your head as you hear our presenters. Feel free to ask questions, but use it responsibly and just keep it related to the webinar topics. And also, if you have Q&A, we will have a Q&A session with our presenters after all three presentations. So save your questions for later. But if you think of anything as you hear the presentations, use the QI feature in the webinar, and then we can, to post your question. Then we can just go back and take it from there. Keep your audio off unless you're speaking, just to help with interruption. And then stay tuned for a follow-up email where we'll send out the recording, some kind of key takeaways from the webinars, and also any additional materials. Just to give you a little bit of a background on this webinar series and what it is about. As we know that there has been a lot of momentum around early warning in the past several years, and the kind of coverage and the scope of early warning systems has expanded significantly, but reaching the place is not the same as reaching the people in this place, and oftentimes coverage does not guarantee protection. If early warning systems cover a specific geographic area, it does not mean that they cover and reach all the people in this area, and also it doesn't mean that every early warning issue leads to early action or protective action taken. And a few years ago, we at GDPC, Global Disaster Preparedness Center, we issued a call for research proposals for researchers in the Global South to look at this specific issue, right? Like, what makes early warnings more inclusive and more effective for those hardest to reach, kind of the most underserved communities. They are kind of geographically remote, or also socially or culturally marginalized, or otherwise underserved by formal system and services. And we found 15 amazing researchers across the world, across 14 countries and 5 regions of the world, to kind of study different hazard, different population groups that all fall under this kind of last mile communities umbrella. And, they did their research, we published their research. There was some interesting findings that came out of this research. And now we're kind of organizing this series of these webinars to help further disseminate, findings and recommendations from those research projects. And as I said, we'll have 4 webinars over the course of June and July. There will be 4 webinars kind of looking at different aspects of the same topic. this is the first webinar in this series, and we'll have 3 more. So if you have not registered for the other 3 yet, yeah, feel free to either use the QR code on the screen, or I'll share the link in the chat later, so you can, if you're interested, register for the remaining webinars. And we also did, after all the amazing research was done, we decided to kind of look across all the papers that were developed, and we did kind of a meta evaluation, meta analysis, meta synthesis of those findings, looking across different hazards, across different population groups, to see at the global level, based on the research done, what are the main barriers and what are the main kind of key enablers to more effective early warning systems. And so yeah, we at GDPC did this meta synthesis analysis, and we published a report, and also an executive summary, and also kind of an visual infographic summarizing key findings that, as I said, takes stock and also looks at all the research done from kind of global level, and formulate some recommendations for making early warnings more inclusive. And yeah, you can access the report here. But I also want to really quickly share kind of key findings. We organized them around the 4 pillars of early warning systems. And as you see, a lot of the findings, they are not new. People who work in this field already know about, already aware about a lot of these kind of barriers. But I think it's also a great evidence-based resource to underscore kind of to show to live the realities of people who are formally covered by early warning systems, but in fact oftentimes the warnings don't reach them, or if they reach them, they can't understand them or act on them. And as you see, as organized by 4 pillars, you can kind of look at key barriers and also enabling factors that can help make early warnings more inclusive for those population. For example, for risk knowledge, we know that risk understanding and risk perception is not just formed by scientific understanding of hazards, but also lived experience and cultural and religious beliefs. They also have a huge influence on how people perceived and perceive risk and act on those risks. And the research showed that oftentimes those kind of lived experiences and social cultural factors are not included in the risk mapping exercises or kind of risk perception assessments. And then yeah, so take a look at the report. When it comes to recommendations, we also build them, organize them around key 3 key areas of making early warnings more inclusive. It's and more effective. It's making them more inclusive, which basically means co-creating, co-designing early warning systems with communities, at-risk communities, or like end users of those systems, because oftentimes the formal system are developed based on the assumption of those communities or those kind of characteristic of the community's members, but oftentimes they're pretty far from the reality on the ground. And that makes a strong case for the importance of involvement of local organization or community-based organization in early warning systems, because they're the closest to those communities and they have kind of the most experience to to be the trusted messengers and kind of trusted actors when it comes to early warnings. Yeah, accessibility, it's important to, make remove the barriers that can stand in the way of people receiving those, early warning messages. It's important to use redundancy in, dissemination channels to make sure that we're not only relying on radio or TV or mobile phones to disseminate warnings, but we're also kind of leveraging those kind of existing social networks and trusted messengers that are embedded within the community to disseminate those messages, because that's what research shows that that's the most effective way for a lot of those last mile communities. And yeah, it just equally important is investing in last mile infrastructure, right? To make sure that there is those community groups, they're equipped with necessary knowledge and tools to to be strong early warning player. And then actionability, as I said, like the issue often that information doesn't result in action, which is the whole point of early warning systems. And there are many reasons why this often does not happen, from like warnings don't include kind of safety messages of like actionable messages of what to do to protect yourself. Or for example, people don't have resources, either material or kind of human support resources to execute those early action. For example, we looked in the case of DTS research that oftentimes persons with disability are told to evacuate, but they can't evacuate unless they're supported by relatives or other kind of community members. And also adequate lead time. We see that oftentimes when warnings are issued, they just don't give people enough time to actually act on those warnings, or to, there's not enough time to prepare and respond to what's coming. Again, I don't want to talk too much, just take a look at the report, and feel free to reach out if you have any questions about the report and some of the findings and recommendations in it. So focusing on, as I said, this event will be a series of webinars, and each of them focuses on specific kind of framing or central question. And in today's webinar, we focus on the issue of kind of structural exclusion, right? Who is structurally excluded from early warnings by the ways warnings are designed and delivered, and what to do, and what do they actually need? Those people, what do they actually need? How can we design or redesign early warning systems to make them more accessible and inclusive for those people that are traditionally excluded from formal systems? We'll have three amazing presenters at today's webinar. First we'll start with Pradytia Pertiwi from Universitas Gadjah Mada in Indonesia, who will talk about volcanic early warning systems for persons with disabilities. Then we'll hear from Tara Adhikari from Aarhus University in Denmark, who did his research in Nepal, focusing on kind of specific considerations of persons living with non-communicable disease and kind of their needs and their unique unique qualities that they need from early warning systems. And then we'll hear from Chinmayee Mishra from Utkal University in India, who will talk about kind of women's experiences in with early warning systems, and also the role of different cultural and religious beliefs and how they impact early warning systems and their effectiveness. Okay, and without as I said, use Q&A feature to put any questions you may have, and then we'll go back to them and we'll answer the questions after all three presentations. And sign up for the next webinar that will take place on June 24th if you want to hear more from our researchers. Sorry for such a long introduction, and now without further ado, I'm passing it over to Ditya for your presentation.
Thank you. Yeah, thank you very much for the opportunity, Vlad. Good evening from Indonesia, everyone. My name is Ditya. It's truly a pleasure to be here with you all. So I think the findings from our research already represented by Vlad's information earlier, but probably I'd like to emphasize on the views of persons with disabilities who in their everyday lives dealing with volcanic hazards. So we did this research, I think end of 2023 until August 2024. And after seemingly endless process, we managed to get it published just recently in April 2026. I will link the publication later at the end of my presentation. So I would have to agree with Vlad that early warning is not reaching everyone, sadly. And we have a global figures on that. In 2023, the United Nations for Disaster Risk Reduction did a survey with over 6,000 persons with disabilities across countries in the world. And only 11% said that they do have access to accessible format of disaster risk reduction or early warning information. The rest of it, 89%, they said around partial access, or they don't have sufficient access, or they don't know even whether such information or accessible information exists. And even more so in the context of people with disabilities, when we said this popular saying that early warning save lives only when everyone can act on them, it even more relevant for people with disabilities, especially with difficulties in mobility. So adequate early warning information can enable persons with disabilities to evacuate. However, even with sufficient early warning, 17% would still have faced a lot of difficulties. Even 6% mentioned that they will not able to evacuate independently at all, even if they have early warning. So the issues of lack of access to early warning and the lack of capacity of early action is not only related to whether the information is available, but it also links to structural issues around disability itself. So take a moment to look at these photos. So this is probably you are aware that this is a modified motorbike. We call it here a three-wheeled motorbike because usually it is manually modified to be able to be ridden by a person with mobility impairment. And this kind of motorbike usually only be able to use by maximum 2 people. But when one of our participants took this photo, when they recalled the memory of volcanic eruption back in 2010, he said that with this motorbike, he evacuated 8 people with disabilities at the same time because the disaster responders left them behind. So it shows that there's still stigma prevailing around people with disabilities. Disaster responders might not be aware of the presence of persons with disabilities. Those resulted in them being left behind. So this shows that there's structural issues around accessing information and being able to act on them, but not only because of infrastructures issues, but also linked to structural. So our study engaged with 182 persons with disabilities in 2 areas in Yogyakarta, Indonesia. So this map shows that this is the location of the volcano, and these are the 2 villages where we conducted our study. So we engaged 182 persons with disabilities. We also collaborated with 9 members of local organization of persons with disabilities, and they themselves become the co-researchers. So they research together with us. And we spoke to 5 government officials. In terms of the methods, we did participatory mixed methods, combining photo elicitation surveys. So we asked people with disabilities to take photos, and as the one that you see earlier, we did FGDs, social network analysis, and also GIS mapping. So our first finding from the GIS mapping, so these dots are the locations of persons with disabilities. And the only installed early warning system in the 2 villages is only one siren located in the north side of the village. and only 12% of the participants within those audible range of the siren system. So if you see these dots and there is blue rings around it, so these are the people that was reached by the early warning. So what about the rest of them? So they eventually receive information, but not through the sirens. So the social networks is lifelines for them, because the information then disseminated through community channels. So this is the visuals of the social network analysis. And the biggest red dots here shows that the information is disseminated through getok tular. Getok tular is a local impression or local translation of word of mouth, meaning that the siren that was heard by community, it was then disseminated word of through community channels. So the duku, or the head of sub-villages, by the most leaders and their family as well, they acted as trusted messengers. And other informal networks such as mosque announcement, or the kentongan is the bamboo slit drum, and the social media like the WhatsApp group and Facebook, for example, it fills the gaps of formal systems. So it shows that trust is also early warning infrastructure. And then our second findings is the missing link between early warning and early action. As Vlad indicated earlier, that even though warnings are heard or warning is received or received by the persons with disabilities, but it's not automatically action or not acted upon. It depends on structural issues, as I already told you earlier, on the stigma, whether there is a social support, and even psychological barriers. Because as Vlad mentioned, when you receive information, but the information itself is not clear enough for you to be able to do something about the message, they don't give the person confidence to evacuate, especially evacuate independently. Think about if you have physical impairment, you are not able to move independently, or you are not able to hear or see. In such crisis, in disaster, for example, there's psychological barriers persist. And those inclusive early warning requires enabling condition. When we ask the 182 persons with disabilities, what would enable you to do early action when you receive information? They mention accessible transport, accessible evacuation routes, and also shelters. Having accessible shelters, giving them the confidence to evacuate because they know they will be safe and taking care of there in the shelters. If there is no accessible shelters, they are reluctant to evacuate, and even they prefer to stay at home. And the second supports is also from the caregiver and support networks from families and also from the volunteers. And lastly is the psychological aspect. So trust and emotional confidence to act. Having a sufficient knowledge on disaster or having a sufficient knowledge on early warning improve confidence in evacuation. That's one of our findings as well. And how then improve this condition? So in the two villages, why we chose the two villages is also because the existence of organizations of persons with disabilities. So they did a lot as connectors between governments, volunteers, and disability communities. There is not naturally interacted, even in normal situation, even more so in volcanic eruption situations. So in one village, for example, OPDs or this organization map where the disability households and give the data to the village government so they know where are the location of persons with disabilities. So when there's crisis or there's eruption, for example, the disaster responders can immediately picking them up. And they also help in co-designing communication formats to disseminate the early warning information through, for example, visual and also tactile cues. And in other village, OPDs also led to inclusive evacuation drills. So together with the villagers, persons with disabilities participated in the drills and also simulated when what will happen after the early warning information they receive. So these are this shows that OPD's engagement, they increase legitimacy, trust, and also the reach of early warning messages. And last thing from me is the key lesson and policy implication. When we think about inclusion, it is truly a process. It requires co-design collaboration, not only retrofitting infrastructure to be accessible, but also we need to improve the social capital through the social network, because it is as important as the infrastructure itself. So as policy implication, start including disability in and consideration within the written guidelines on in the early warning or anticipatory actions. Also acknowledge the coexistence between modern and also traditional or indigenous early warning systems. So integration of siren or other modern infrastructure for early warning system with indigenous such as mosque, kentongan like bamboo slit drums or other means of indigenous early warning system. And then allocate budget for different formats for accessibility. As I mentioned earlier, work together with persons with disabilities themselves to design the formats that is accessible for them. And lastly, also promote participatory governments where persons with disability hold leadership roles in early warning system planning. Thank you very much for the time, and I would be happy to answer questions. Thank you.
Yeah, thanks, Pradytia. Since you finished a little bit under time, I think we have like a little bit of time for one urgent. If someone has like something they would like to clarify on, or yeah, for Ditya to expand on, now's your chance. If not, as I said, save your questions for later. We'll come back to Ditya with Q&A. Anyone? Okay, if not, that we can move on to our next. And as I said, for like questions, feel free either to drop them in the chat or Q&A feature, or just unmute and ask them out loud, wherever you prefer. But if not, we'll move on to our next speaker, Tara Adhikari from Aarhus University. Tara, over to you.
Thank you, Vlad. Hello, everyone. My name is Tara Ballav Adhikari. I'm originally from Nepal, and currently I'm working in Department of Public Health here in Aarhus University, Denmark. Firstly, thank you to both of you earlier speaker. You summarized many things very well. So I think my task is fairly easy. So I think you'll find some kind of repetition as well. But yeah, so the starting with early warning systems are often, when we say it's judged by whether the message was sent, or whether the monitoring stations are working, or whether the message is sent to the particular municipality if it is covered. But the particular population I'm talking about, the people with non-communicable diseases or chronic conditions, that is not enough. So that was the base that we started to explore this topic. A warning system only matters if the person can receive, as already stated by the previous speaker, if they can receive and understand and act on it before it puts them into the health risk. So my focus today is to share some findings from the study I conducted in Western Nepal back in 2024, funded by GDPC. So in my presentation, I'll take you through some of the learnings or the knowledge that I received regarding why early warning systems fail for people living with NCDs and what needs to be changed so warnings become actionable, or they most likely to be less missed in the system. So to understand this why it matters, we first need to look into what is the overlap between disaster risk and chronic disease in Nepal. Nepal, it's in South Asian country that lies below the Himalaya and with a variety of geographical features. It is highly exposed to floods, landslide, and climate-related hazards. And at the same time, as global phenomenon, as also in Nepal, the non-communicable diseases like cardiovascular disease, diabetes, COPD, respiratory condition, asthma, they are the dominant cause of morbidity and mortality, which accounts for more than 71% of deaths. So disaster preparedness is no longer about the immediate injury and rescue, because the population dominance of the disease burden is so much on that it has also to be focused to protect the people who depend on this continuous care. For people living with this condition, it may also mean to prepare medicine, to keep the prescription, or arrange transport, and many more things before the system is disrupted. This is why people living with NCD often needs more time, or they require more specific guidance to support that. Generic flood warnings provides are not only generic, it needs to be more enough for the people to act on their particular condition. So we therefore wanted to understand from the perspective of those people and the local responders, and what actually prevents them from warning messages, or how it is a barrier for them. Before we move into the findings, this is a brief overview where we collected our evidence. This is a qualitative study we conducted in a 2 flood-prone municipality of far western Nepal. We spoke with the 96 participants with focus group discussions, in-depth interview, and key informant interview, which included people living with NCDs, the healthcare workers, the local responders, the government actors, and non-governmental organization institutions are the responders as well. So the purpose was not only to ask whether the early warning message was sent, we wanted to understand whether the people with NCDs could actually receive them, how do they understand them, do they trust them or not, and is there the supportive mechanism that can help them to act during the floods. So from this study, we identified 5 ways, 5 main messages, so that we think it's important to share in this platform. The main message is that exclusion is not only about whether the warning is technically sent, as I started. It should be people can live inside the area covered, but it's more focused on whether there's a functionality after the warning message is disseminated, or how it is designed. So we saw 5 main mechanisms. First, about the timing. Warning may arrive too late for the people with NCD, so that they can't prepare anything on their behalf. Second is the vague content. Message may warn about the rainfall or flooding, but they will not talk about what the people with particular conditions should actually do at that timing. Another is about the language literacy and channels. Message mostly is sent in a dominant language, that's a Nepali language, but there's a different dialect, there's a different community who speaks the different language, and the literacy level is also different. Some are illiterate, so it doesn't work for everyone. The fourth is already, as shared by the previous presenter, it's about the designing. There's a limited involvement of people living with NCD about the testing, about the contents of the early warning message, and so on. So this leads to the weak linkage with the care. So the key point is this, like being covered by the system is not same as being able to receive it and act it. So in next few slides, I'll try to unpack these individually. First, people living with NCDs are excluded by the timing and the vague message. Many participants in our study, they explained that the warning messages are often arrived after the rainfall that had already started and when flooding is already in the area. For people living with chronic condition, this delay is very crucial and it matters much. They may need time, as I briefly mentioned, like to collect the medicines, to protect the prescriptions or health documents, arrange the transport, and also contact the caregiver or family members so that they can move out before the road are blocked. Second issue is that if messages are often too generic, they may say that heavy rainfall or flooding is expected, but they do not say what people with particular conditions should do differently in particular situations. So the generic message sometimes doesn't work for the particular population. The warning may technically, it means like because it is disseminated, so they say like we have sent 1,000 SMS, but it doesn't mean that the community is reached totally. So this should be useful as well. And these populations, even if it arrives early, if the message is too generic, it doesn't provide some practical guidance. The next barrier is about the language and literacy, as I mentioned. In this study, community early warning messages were often delivered in Nepali language, as I mentioned, through mobile phones, especially in SMS. But that doesn't work for everyone equally because they speak a local language and different dialects, and some have very low literacy, like older adults or people with limited phone use. They cannot easily read and interpret the text. So others may miss alerts because they are mixed with the routine phone messages as well, when you got it in between some of the messages. One participant said very clearly, like, I do not know how to use the phone and read the messages. So this shows like sending the message is not same as the communicating the warning. So for early warning to become early action, the message has to match people's language, literacy, and the channels should be trusted. In practice, SMS should be combined with the local language or loudspeakers or the community radio. Like in earlier presentations, she talked about the local leaders, like whether the religious leader or the community leaders or the local volunteers, that should be the mix. So only one channel is not the sufficient approach in this kind of situation. So, but the access is not only about the communication channel, but it is also about whether people were involved in shaping early warning system itself. So here I'll talk about like third, that people living with NCDs are often excluded in the design and trust building process. They are expected to act on warnings that they were rarely involved in designing, testing, and delivering. This matters because if message does not reflect people's real constraint, it may not feel relevant or practical and trustworthy. So one key informant said that I have never heard or seen any community people getting involved in the process. So this shows that the issue is not only about the technical communication, it is also about participating the people or involving the people in ownership and trust building process. So for practitioner, the implication is clear that before the flood session, warning messages, response protocols, they should be tested with the people with NCDs, and local volunteers should be involved so they know what to do and where to trust. So all inclusive early warning requires a co-design, not only about the dissemination. So the next point fourth is about people living with this condition, chronic condition. Early warning is incomplete. It is not linked with the continuity of care. That is crucial part in people living with chronic condition. During flood, I briefly mentioned, like roads may be blocked, health facilities may be inaccessible, medicines may run out, and people may miss follow-up. So one participant explained that the people with NCDs cannot reach hospital because the road is blocked. This is why early warning messages should not only say that flooding is likely, they should also trigger the practical health actions like check your medicines, prepare your prescriptions, be ready for the movement and everything that is required, or major key messages. So the key message is that early warning should not stop at the information. It should connect the need of the particular population in the community. Another mechanism is the exclusion, is another credibility issue. Trust is the central in early warning systems because the people only act if they believe that the warning is relevant, accurate, and useful. Some participants described the frustration when warnings did not match what happened or when messages were too frequent without clear relevance. Over the time, like this can make the people stop paying attention when the future warning is not serious. But trust is not only about forecast accuracy, it is also about whether the warning is specific enough to guide the action and whether people see any support after that warning. So if people are told like that to prepare, but there is no transport, no medicine support, no healthcare worker, and no clear next step, then that loses the credibility. So trust is built when warnings are accurate, timely, and also it is followed by the visible action. So when early warning messages are late, unclear, or inaccessible, the consequences are not only about delayed evacuation. For people living with NCDs or the chronic condition, the chain is very practical. A late or unclear warnings means there is a little time to prepare medicines, prescriptions, and all the preparations. Once flooding begins, the health facilities get closed and difficult to reach, and medicines become unavailable. This can also lead to the missed doses, missed follow-up, and worsening of the symptoms. It also creates the fear and stress and reduced trust in the system when the people repeatedly receive the warning that do not help them to act. So for people living with NCDs, early warning failure can become like the failure in the continuity of care. That is crucial part of people living with NCD chronic condition. This is why inclusive early warning systems must be linked with health preparedness, not only about the hazard communication. So the early warning should combine both the preparedness aspect and along with the hazard communication. Then the final question then is what is the practitioner or what practitioner and local health system can do differently before the next flood season is there? The practical question is about first, the local system should identify the people living with NCDs or particular condition who may need the extra support. This includes people who depend on regular medicines, have mobility limitations, need caregiver support, or may require transportation and follow-up. Second, warning messages need to be clear, earlier, and locally adapted. This should use the local language and simple formats that people can understand quickly. Third, warnings should include health-specific action as well and advice. Fourth, SMS should not be the only one channel should not be the relying or the mode of communication. So message should move through the trusted local channels like FM radio, loudspeakers, or the direct calls, the local volunteers, Red Cross volunteers there, or the local leaders. So that are some of the recommendations. Finally, early warning must be linked with the health service readiness. This means like medicine stocks, health post, mobile outreach, referral options, and follow-up. The main shift is from simply sending warning to making it more like actionable. So in my last slide, I'll close with the 3 key messages. That is first, very one simple thing, like inclusive early warning message is not only about whether the message is sent. It should be focused like whether there's action after the message is sent or not. From our study, it requires 3 shifts. First, from geographic coverage to the early warning system, our message should focus on people-centered reach. We need to ask not only whether area was covered, but whether the people could actually receive, understand, and trust the warning. Second, we need to shift from generic alerts to the health-specific action advice as well. For people living with particular chronic condition, warnings should include the practical reminders about medicines, prescription, mobility support, caregiver support, and emergency contacts. Third, shift must be from the warning dissemination to continuity of care support. Early warning should be linked with the health post, medicine stocks, referral, outreach, and follow-up as well. So the key takeaway is this, that the early warning is inclusive only when people must at the most risk can act on it. Thank you so much, and I look forward to the questions and discussion. And these are my team who conducted the study. And I think you have seen the report as well in the link, but this is, you can scan the QR if you need it. That's a full report on GDPC website.
Yeah, I also drop link in the chat. Thanks, Tara. And unfortunately, Tara will have to leave us after his presentation, so he won't be able to stay for the Q&A part. So yeah, if you have any questions for Tara, now it's your chance to ask him.
Yeah, and if you don't have any questions at the moment, you can drop in chat. I'll be next 10 minutes. I'll be still in the webinar, so I'll try to respond there as well.
Well, if people in the audience don't have any question, I have a question for you, Tara.
Yeah.
I know that your work, this research, and kind of your other work on this topic resulted. You also work with Nepal Red Cross, I think Danish Red Cross, and other partners
Exactly.
in Nepal to kind of take this work forward and develop like a package for non-communicable disease intervention in disaster settings that also now it's kind of been reviewed and discussed by the government of Nepal. Can you maybe tell us more about that, how like this research informed this like broader work, and like what does it mean for persons living persons living with non-communicable disease if like this package were to pass were to be accepted by the government?
Yes, thank you, Vlad. That's very important work, and that's where we started. Like when we got this funding and when we do this formative qualitative research, that gives a very good ground, like why we need to act on it. So we, together with Danish Red Cross, Canadian Red Cross, we as Aarhus University and Nepal Red Cross Society, we developed a project called Resilience NCD, where we are trying to, based on these findings, we're asking like what could be done then, like just not asking, oh, there's a problem. So we started to shape a project that will design a package for people living with NCDs during the disaster for the continuity of care and the preparedness, or all phase of the disaster, we would say. In non-communicable diseases, there is a global program or the approach or the tools called PEN package. That's for the normal setting. But during the disaster, we try to contextualize that package during the disaster. And that has been because if you most of the participant here, you are aware about like if the response during the emergency or the programs are mostly the evidence is generated from the conflict or the war situations, but there are very limited evidence for the people living with NCDs during the natural disaster and so on. So the kind of work we are doing in Nepal, it's about to be published, is the first of its kind so far that is trying to develop a package that makes the continuity of care or thinks on continuity of care. And right now, government, as Vlad indicated, the government of Nepal is validating or they are seriously taking it so that they can integrate into the existing program of the Ministry of Health. So we are working on that advocacy part as well, so that it's not evidence and a package developed in a document, so they can integrate really in the programs and policies. So that's going on right now. So, but the foundation is this work that triggered us like, okay, there's something need to be done.
Thanks. Yeah, that's very exciting and important work. And there is another question in the chat for you, Tara. It's Tara, how did you engage with the communities initially to motivate them to engage with the early warning system?
In this work, we just explored it. It was a very exploratory qualitative study, so we didn't acted anything, but the project that followed after this study for the last 2 years, we are working with them, as I said, in the gap, like the major gap is like the lack of co-design, lack of involvement of the people. So if you already start to involve them from the very first phase of the project or the first phase of the designing the program and package that is tailored to them, I think that will create a ownership, that will build a trust, and that will also help them to understand where to act. So right now in our project, when we are designing this PEN disaster package for people living with NCDs, we are involving them in the every phase of the program development or the message development from the until the testing or whatever aspect of the project is being implemented. So they are the equal stakeholders. So that will engage them, or that will motivate them to act on it as well, and also build the trust on the process.
Thanks, Tara. And yeah, so if you have yeah, Tara will still be with us for the next 10 minutes. So if you have any questions, drop them in the chat and he'll respond in writing. And we need to move on to our next speaker, Chinmayee Mishra from Utkal University in India, who will talk more about your study on exploring women's experiences and barriers to early warning systems in Odisha, India. Chinmayee, over to you. Chinmayee, do you?
Thank you, sir. So are you presenting my slides now?
Yes. I think your video is lagging behind a little bit. Maybe you can turn it off and just use the audio to help with the bandwidth.
Okay, thank you, sir. So am I audible now?
Yes, we hear you loud and clear, and I have your slides up.
Good evening, everyone. Namaskar. I'm Chinmayee Mishra from Utkal University, and thank you for giving me this opportunity to present my research. And today I'm going to present my project, which has been titled as Disasters Cannot Happen Here. Lord Jagannath Will Save Us. Exploring women's experiences of the barriers to early warning system in Odisha, India. So when we think about the barriers to early warning systems, we mostly focus on the technological aspect of EWS, like on technology, infrastructure, or communication network. But my research shows that
that warning may fail to turn into action even if they reach the community, like all the presenters were discussing. So the major factors like social inequalities, cultural norms, and even deeply seated religious beliefs can influence how people interpret risk and whether they choose to act on these early warning messages or not. So, next slide. Coming to the context of the study, Odisha is located in the eastern coast of India, and Odisha is also one of the most cyclone-prone states in India. Over the past century, the state has experienced nearly 260 cyclone landfalls, and in the last 2 decades itself, Odisha has been struck by 10 deadliest cyclone that is affecting India's coastline and making Odisha one of the most disaster exposed regions of the country. And Odisha has also been famously known as the disaster capital of India. So, in this context, my study focuses on cyclone Fani. That is a category 3 storm that made landfall on 3rd May 2019. It was one of the strongest cyclone to hit Odisha in nearly 2 decades, like after 1999 super cyclone. It was one of the major cyclone that hit Odisha, and that cyclone affected many villages, many districts, and people incurred severe economic losses too. So, within this context, my research examines that women's experiences of accessing and responding to early warning messages in coastal Odisha to find out the barriers that women face in accessing early warning message during Cyclone Fani, and to explore whether these early warning messages reach women from disadvantaged socioeconomic groups. Next slide. So the study design mm, goes like this. The study area was Puri district, as I have given it in the context. It is Puri district is actually a coastal pilgrimage site, one of the India's Char Dham. India is having 4 holy sites, and Puri Dham is one of those holy pilgrimage site that was hit by Cyclone Fani in 2019. And this study was an exploratory study using mixed method. Both qualitative and quantitative methods have been used to conduct this study. This study was conducted actually in 2 phases. First, during after Cyclone Fani in May 2019, post Cyclone Fani in 2019, first phase was conducted, and in 2024, the second phase of this research was conducted, which included the voices and experiences of women and also the stakeholders. So the sample of this study is 348 respondents, among which we have taken a household survey of 211 women, and other 173 stakeholders' opinions are also included in this study. The stakeholders include the ASHA workers, Anganwadi workers. ASHA and Anganwadi workers are the female grassroots level community health workers, frontline health workers in India. The Apada Mitra are the community level disaster management volunteers. ODRAF, the Odisha Disaster Preparation Staff, and the NGOs, those were engaged in disaster preparedness. And the elected members are the political elected members, like the Sarpanch of the villages where the research has been conducted. So next slide. So coming to the key findings, we can see that one of the most important findings of the study is that the access to warning did not turn into the real preparedness. We found that around 90% of women, they reportedly received early warning messages and were aware that the cyclone was approaching. This indicates that the overall reach of the warning system was relatively high. But despite receiving this warning, most of the women, they did not take adequate preparatory action before the cyclone. This reveals that there is a gap in risk comprehension. So while many respondents knew that the cyclone was approaching, they were aware of the wind speed, uh, but only 40% of them correctly identified Puri as the expected landfall location. More importantly, we can find that 93.6% had no information about the severity or the potential impact the cyclone Fani can have on them. So this finding suggests that low risk perception emerged as one of the primary barriers to preparedness. We can say that people heard the warning, but they did not believe that it was a serious enough threat that required immediate actions. So, going through the theme of the webinar, that the people, those who fell through the cracks, were not necessarily that those who missed the warning. They got the warning, but they underestimated the severity of risk. Next. So coming to the barriers of access to early warning, one of the striking findings of the study, which has already been uh, shown in the project title itself, was the influence of religious belief that impacted the risk perception and evacuation decision. Several women, the respondents, they expressed that strong faith on Lord Jagannath would protect Puri from disaster. As I was telling that this is a pilgrimage site, and Puri is considered as the abode of Lord Jagannath. And the city would be spared from severe cyclone impact of the cyclone. Also, this belief was very rampant in Puri district, and this was also further reinforced from the collective memory of 1999 super cyclone, which caused damage to the other parts of Odisha or other districts of Odisha, but had a comparatively limited impact on Puri. So, as a result, for some women, this faith-based belief was more than the risk information that they received from the government or from other volunteers. This this reduced their perceived need for their preparedness, including the evacuation to the cyclone shelters. This shows that how the cultural and religious worldviews can also influence and influence the interpretation of warning messages as the respondents they receive. Even even the from the viewpoint of the stakeholders like Apada Mitra volunteers, they also identified this faith-based fatalism as one of the important significant barrier for disaster preparedness, giving it the highest score of 8.4 out of 10 for this barrier. Next slide. So the second and the third barriers identified where the like normalization bias and cry wolf effect, and both of which contributed to the low risk perception among women. Interestingly, more than 90% of the respondent had previous experience with cyclone, but with rather than having more preparedness, these experiences created a false sense of security within themselves. many women compared cyclone Fani with earlier cyclone that had caused limited damage in Puri. So they concluded that this event of cyclone Fani would also be manageable for them. This reflected that what other disaster scholars describe as normalization bias. In normalization bias, there is a tendency to underestimate the threats because previous disaster didn't result in severe personal consequences. So this time also they will not face the impact of disaster. So this creates normalization bias. So, and also cyclone Fani was unusual because it was a summer cyclone. Generally cyclone, people are prepared near October and November to for cyclones, but as Fani was a summer cyclone in May month, this also led to many residents did not perceive it as a serious threat, and they delayed taking precautionary measures. So even many of the respondents said that every year we are getting warnings, but cyclone is not happening. Or even if cyclone like Phylline, Hudud, Titli that happened, but it was not severe in Puri. So this declined the trust in the early warning messages that they received during cyclone Fani. So the repeated experience of perceived false alarm. I'm not blaming that those are false alarms, but they perceived this as false alarm, which reduce the credibility of early warning system, and many women dismiss this warning associated with cyclone Fani. So from this finding, we can see that the effectiveness depends on how past experiences of people, this also shape in how people interpret risk. Next slide.
Chinmayee, just a heads up that you have 2 minutes remaining.
Okay. So the next barrier, if we see that who falls through the cracks, we see that spatial marginalization, like the Dalit women in Harijan Sai. Dalit women are, if we see that Indian society is a caste divided society, society is divided on the basis of caste, and those who are outside the strata of Brahmin, Kshatriyas, Vaishyas, and Sudra, they are considered as untouchable or Dalits, and they reside in the margins of the village. So they live in Harijan side, and if they are living in the margins of the village where the public addressal system announcement, it cannot reach there, the four-wheeler system do not go inside the village, they travel through the main road, and for that, due to spatial marginalization, Dalit women who are already marginalized, they are unable to access the um, early warning system. And along with that, disability and age, like elderly women, pregnant women, and disabled women, they also face physical and communication barriers, like Tara sir was discussing, like and Pradytia ma'am was talking about the mobility issues with persons with disability, even language barriers, like people from neighboring state like Andhra Pradesh, they were speaking Telugu and not Odia. They were fisher folk from Andhra Pradesh. So language is also a barrier. If the language of early warning was in Odia, so many migrant community, they could not access early warning messages. Next. So next barrier is the digital divide and place attachment. So due to technology gap and the digital divide, women mostly use keypad phone without internet. So government text were ineffective due to illiteracy and the lower socioeconomic status of women in Puri district. Although TV was top source of information in most of the houses from lower socioeconomic groups, they TV, they didn't have access to television, mobile phone. Even 50% of them were illiterate. Second was place attachment. Their attachment to home and limited assets. They wanted to preserve their assets and stay with them. They didn't want to, for one single disaster, they didn't want to lose their lifetime asset. They feared that someone will stole their things, and they also neighbors influence them. And they also had trust on Lord Jagannath that disaster will not happen here and they will be safe. Next. So this was a force field analysis which showed that the barriers versus facilitators. However, from the stakeholders' perspective, we found that the facilitators were more than the barriers, as Odisha's decentralized disaster management and grassroots volunteer network are stronger. So the barriers emerged as less than the facilitators. But even if the barriers were less than the facilitators, but targeted interventions are still required for the last mile communities. Next. These are some of the policy, practical, and managerial implications. Our project speaks for behaviorally informed and culturally sensitive early warning system. It also strengthening capacity of the stakeholders and recruiting frontline workers from community itself, using multilingual early warning messages so that people with disability also they can access migrant communities, people with from different coming from different languages states can also understand the dissemination of warning information. And there should be focus on trying to reach the most vulnerable population like the Dalit women, the disabled the persons with disability and the migrant women. And the feedback system from the grassroots volunteer workers like Apada Mitra volunteers are also required because they have experienced what there is lacuna in the system, so they can give better feedback to the government. And integrating all these community workers, encouraging women marginalized from marginalized community to participate in designing early warning materials, at least as a part of procedural justice. We can we should participate them. And through CSR, corporate social responsibility, we can improve the last mile EWS infrastructure. So at last,
Okay.
a warning is effective when it can reach people who need it the most, but mostly those who are often at risk, they are the last to receive those information. So the focus should be basically on behaviorally informed and inclusive early warning system. Thank you.
Thank you, Chinmayee. Okay, so we have just a few minutes remaining. So if anyone has a question to either Chinmayee or Ditya, feel free to ask now.
Oh, Fred, may I elaborate my answers to Maria? Sorry, my connection was dropped earlier, so
Yeah,
at-
go ahead.
so yeah, unfortunately, we did not look at humanitarian inclusion standards because we used the guideline from the UNDRR, the early warning for all checklist, particularly for gender and persons with disabilities. But when I read through the HIS, and I saw a lot of overlaps with our findings, especially with the key inclusion standards identification, so the needs of having data on persons with disabilities to be able to map them and also plan early warning around and consider their location for the early warning to be able to reach the location of persons with disabilities. So I think that's the important of having the disability data and particularly their geographical locations. And then the knowledge and participation, of course, as I said, that having the knowledge of the warnings and what to do with the warnings, what comes after that, give persons with disabilities the confidence and those enable them to meaningfully participate in the whatever program, especially with regards to early warning. And also, I think I put there several overlaps with the other two key inclusion standards. But yeah, overall, that I see the relation between his and my findings. Thank you.
Thanks, Ditya. If our participants don't have any questions, I have one last question to you that you can also treat as your kind of closing summary to both Ditya and Chinmayee. So if if we have like a disaster management agency or like national alerting authority watching, attending this webinar today, what could they change? One thing that they can change tomorrow, to make early warning systems more inclusive and, effective for those kind of hard to reach and last mile communities. What would you recommend? What fix would you recommend, and what's the kind of low cost fix, that matters, that they can do, to make, as I said, early warnings more inclusive for, the populations that you studied. I don't know if, and if you can keep your answer really short, like under 1 minute, that would be great. So, Ditya, if you want to go first.
Yeah, I think if there is organization of persons with disability in your locations, I think start engaging with them, because to understand what's the needs of persons with disabilities is to best talk to them directly, and then they will let you know like how is the best way for early warning to reach them, in what format, how, and the location as well, as I said, and then start including them in the planning of early warning information, implementation of the programs following early warning, especially the disaster preparedness program. And yeah, I think the rest, would depends on how the quality of relation between governments, like local governments, and the organization of persons with disabilities. Thanks.
Thanks, Ditya. Chinmayee, what are your thoughts on this?
According to me, if I look, I have done my research in the rural area, and the decentralized way of getting early warning messages to the each and every corner of villages depends on how strong the village networking system are, like the interplay of Asha, Anganwadi workers, Apada Mitra volunteers, elected members, political representatives of that village. If these people, these stakeholders and the community members, they come together in a decentralized manner in the whole village, the early warning system and the messages can actively reach. So this one small change at each village level. If we do, we can see visible changes at district level and state level.
Awesome. Thank you so much. Well, we're at our time, so thank you so much. Thanks for our presenters for sharing their work, and thanks to all of you for attending this webinar. As I said, stay tuned for kind of a follow-up email with a recording and kind of key summary of key insights from the session, and also sign up for the other 3 webinars in this series. We'll have our next one on June 24th, and there is a link in the chat for you to register for the remaining webinars.